Good morning, everyone, and thank you for joining today's webinar titled The Future of Healthcare Hiring 2024. Without further ado, I would like to introduce today's speaker, Brett Kerhofer. Brett, you may take away.
All right, thank you so much. Welcome everybody to the Future of Healthcare Hiring in 2024. Excited to get going today. Before we get started, a little bit about myself. My name is Brett Kerhofer, Market Strategy Lead here at Hirology. I've been with the organization now a little over 7 years, and almost exclusively during my time here, I've spent working with owners and operators in the post-acute care space, helping them build their best teams. There's a lot of great things we do here at Hirology, one of which is our ability to understand the market better, both from the applicant side and the hiring manager side, the owner and operator side. And that's what we're going to be able to dig into today. So excited to take you forward with the presentation. All right. So the goal of this webinar is to answer these questions as we cover the data. Number one, are you facing the same challenges as your peers when it comes to hiring and retention? Where are your peers sourcing top candidates for hard to fill roles like CNAs? What are your peers' goals as it relates to recruiting and hiring in the year ahead? And what opportunities do you have to stand out and capture your fair share of today's healthcare industry job seekers? A little bit about the research. In December 2023, we surveyed HR employees at healthcare facilities across the United States. Survey questions touched on the following themes here: 2024 hiring challenges, average hiring speed, top channels for applicants and hires, and hiring process bottlenecks. So what's slowing people down during the process? So let's go ahead and dig in. The first theme of data I want to touch on is overall healthcare hiring challenges. We'll go through what facilities are struggling with as it relates to hiring and retention, as well as our advice for overcoming these challenges. So overall, despite a cooling job market, we're finding that healthcare facilities, by and large, are still finding the hiring climate to be incredibly challenging. 94% said that hiring at their facility is still somewhat or extremely challenging, while 90% say retention is still a challenge. 44% say they feel hiring is even more challenging than it was a year ago. And about 50% have more open roles this year than they did last year, while 26% said the number of open roles has stayed the same. When you think about the state of healthcare employment in the last few years, this makes sense. The pandemic triggered extreme burnout among many of these professionals who had opportunities to seek work outside of their field. And on top of that, younger workers entering the workforce are less likely to choose CNA or RN professions. So where do the greatest challenges lie when it comes to hiring at these facilities? Most report that CNAs are the most difficult role to fill today. And again, given what we're seeing with declining interest among younger workers, combined with high levels of burnout, the results of this question make sense. Simply put, there are just fewer people out there with the skills or general interest in gaining those skills to meet the demand. And demand for these types of roles is always going to remain steady. People are always going to need healthcare, even more so in the next decade, given the high aging population in the country right now. So not only are CNA roles difficult to hire for, but they're even more difficult to retain, with 69% of respondents reporting that this role drives the highest turnover. I think by and large, this can be attributed to the same burnout I mentioned earlier, and that's difficult work combined with low pay and inflexible benefits. That stuff tends to drive turnover. As we get further into this presentation, I'll talk about what facilities can do to provide benefits job seekers in this profession are actually looking for. When we ask respondents to go deeper into the why they find hiring so challenging, no-shows and ghosting top the list, meaning they're able to get candidates in the door, but they find they often drop out without warning at some point during the hiring process. In years past, when we've conducted this study, we've typically found that applicant volume tops the list, but now we're seeing speed and process be the top issue. Job seekers typically ghost employees and employers when they get other jobs or the process is taking too long or it's too complicated. This shift might be due to ongoing inflation, leading more people re-entering the workforce, but they still have the upper hand and plenty of options for work. So they can afford to ghost employers if they don't hear back fast enough, or the hiring process doesn't fit their schedules or need. So think, is the process mobile friendly? If not, that might be a top reason why they're ghosting you. And we'll touch more on that later. So our advice, how to handle this. Number one is build the foundation with a great employer brand. The number one way you can stand out during a time of high competition and low talent supply is with great employer brand. This is especially important given the negative perception of CNA roles in particular. And before you make any other changes to your recruitment strategy, it's critical that you spend some time revisiting your employer branding messaging and materials. So this might mean drafting new positioning about what makes your facility stand out, right? Maybe you offer exceptional work-life balance. If so, we need to highlight that. Or completely redesigning the look and feel of your career site and other branding materials. Number two, foster relationships with local schools. There's no doubt that the youngest generation of today's workforce is going to be critical to helping facilities fill important patient-facing roles. But many of today's younger workers are often encouraged to pursue office-based blue-collar work. Once you've revamped your employer brand, you can start taking your messaging directly to the next generation of workers at high schools, tech schools, and four-year colleges. Digital channels for recruitment are always important, but almost nothing beats face-to-face conversations when it comes to swaying opinions. So offer to speak to groups of students enrolled in relevant programs, create on-site job shadow programs and other learning opportunities, or donate scholarships. Third, prioritize your referrals. The chances are your high-performing CNAs and RNs know people who are just like them. So why not leverage this? Of course, most facilities have an employee referral program in place, but the key is finding ways to get more out of it. So make it a requirement for new hires to list people they know from previous roles or training programs and nurture these contacts over time, or consistently reach out to your staff via text reminding them of open roles as well as your bonuses that you're offering to ask them for referrals. At times of highest demand, consider raising the bonus payout amount. All right, you can see here, fourth is texting. And I have texting here listed on my notes. This is super critical, right? Once you do have great candidates interested in your roles, you need to do everything you can to keep them engaged and combat the no-show problem that we discussed earlier. Texting is one of the best ways that you can ensure that top candidates remain interested in your facility. Texting can also be used not only when you move the hiring process along, so think scheduling interviews, kicking off onboarding processes, but it can also be a great tool for simply ensuring top candidates know what's going on and what they can get when they come to work for you. Use text to remind great candidates of your benefits, competitive pay, growth opportunities, and more. And last, you can see here is create an employee-friendly onboarding program. Studies find that one of the biggest drivers of retention is great onboarding for new employees. When is the last time you revisited your onboarding program? Think to yourself. Your program should offer digital options for both new hire paperwork and include documented week one plan for your new hires that lays the groundwork for long-term success and fulfillment, including relationship building as well as extensive training. All right, next, I want to touch on what we're seeing from facilities when it comes to benefits offered and overall job design. So by and large, facilities are offering a good range of benefits across the board. Things like great workplace culture, schedule flexibility, and even education reimbursement topping the list here. And when we asked job seekers what benefits they value most outside of pay earlier this year in our applicant study, the same benefits top the list as well. So in other words, if you're part of the percentage of facilities not offering these benefits, especially flexibility, which is crucial benefit in any industry known for burnout. You're likely missing out on top talent that's choosing to apply to your competitors due to the benefits being offered here. This data should come as no surprise to you here on the screen, but when we ask facilities how much they've increased wages in order to attract top talent, 75% say that they've increased, with 39% noting that they've increased it by more than 10%. So while increasing wages over the past year has, of course, been necessary given inflation, combined with a continued talent shortage, it's also worth noting that wage wars are not only going to win the continued healthcare talent shortage. There's more that you can do. In fact, in our applicant survey that I mentioned earlier, 90% of job seekers in the healthcare sector are willing to take a lower paying job in exchange for the right benefits. So the way to win without consistently raising compensation is to offer the right package of benefits. And of course, it's critical that you market these benefits as well, which is what we're going to get into here on the next slide. We also found that 71% of healthcare facilities have a formal DEI program in place. If you're a part of the 30% that does not focus on DEI, this is also likely hurting your ability to maximize quality candidates. Study after study shows that job seekers today, and especially younger job seekers, want to work within diverse environments that reflect the world and their communities, as well as the environments that are inclusive. And on top of that, diverse and inclusive workplaces are proven to drive better business outcomes due to people feeling supported and empowered to do their best work. This is especially true in healthcare, where facilities with staff diversity that matches overall communities served tend to provide better care than those that don't. In other words, DEI is really table stakes today, and it's something that can have an impact on your ability to recruit and retain talent and provide the best possible patient care. So let's take a look at some of our typical advice when it comes to designing jobs. 4 things here. Audit your benefits, and that's things like career growth, fulfilling work, culture, schedule flexibility, and DEI, right? Job seekers today are looking for more than just a paycheck. They want to feel like they can grow within their employers and they're making a difference. And based on the survey, we know that many facilities are taking the necessary steps to offer these benefits. Take some time to audit what you offer and identify opportunities for your benefits where you can afford to add and ensure that you're remaining competitive with the market. The good news is that you likely already offer many of the job perks that people are looking for, like flexibility and or tuition reimbursement. You need to find a way to make that clear in your employer branding messaging. Then you can see here, rewrite your job descriptions. Once you have a grasp of what you can offer job seekers and how you want to message those offerings, it's important to clearly state in your job descriptions. Gone are the days of simply stating what the job entails along with requirements. Your job description should resemble an ad for a product or service. Sell what job seekers are going to get from you. Lead with perks like culture, flexibility, and more. Then dive into the requirements and the day-to-day duties of the position. And then last year is update the career site. With an updated job descriptions in hand, take the same approach with your career site. Think of it like the homepage for your facility's patient-facing website. What do you offer job seekers that they want? What makes you different from the facility down the street, or even from a Target or Amazon? Use your career site to shout out these selling points from the rooftops and really attract those top job seekers. Next, let's dig into the questions we asked around talent sourcing. So where are people getting applicants in the door from? When we ask facilities to select all the sourcing channels they use, it's clear that most are casting a wide net and using a good mix of different sources to reach top talent, including social media, employee referral programs, job boards, and career fairs. What this tells us is that a multi-channel sourcing strategy is the norm in healthcare today, and it's something you should absolutely need and do in order to remain competitive in this sector. So we know that facilities are using a good mix of sources, but which sources are performing best? What's driving results here? When we ask facilities which sources drive the highest volume of candidates, so the most total number of candidates, paid and organic job boards top the list, followed second by social media. But when we asked facilities where they're getting their quality applicants from, we did see a bit of a shift. While paid job boards is still the top of the list, referral programs actually shot up to second place, overtaking both organic job boards and social media. So what this tells us is that there is a quality versus quantity situation at play here. If you want to drive sheer volume of candidates, job board is absolutely the best bet. But if you're looking to maximize quality and not necessarily just quantity, you might want to prioritize both referrals and job boards. And given the nature of healthcare jobs, it's better to focus on quality over quantity. You simply cannot hire someone in healthcare without the right training and certifications. So why not focus on attracting fewer people with the right background as opposed to more people who lack even the minimum requirements? But despite referral programs being a top driver of quality candidates, most facilities aren't doing everything they can in order to get the most out of these programs. Facilities are by and large still relying on spreadsheets to track referral candidates and word of mouth to promote their employee referral program. Only about a quarter use text messaging to promote the program. Over 40% say they wish more employees would participate in that program. So why is this an issue? Why is this the case? Well, because if you think about your workforce today and their day-to-day jobs, they're not necessarily incentivized to participate in the program. If you're rarely communicating your program with your staff and failing to constantly and frequently promote the roles that you're looking to fill and the bonuses that you're willing to pay out in association with that, you're missing an opportunity. You need to think about it like marketing, a campaign at your facility. You want to reach your team on the channels they're using, which in today's, state of the market is the smartphone, with the right message to drive participation. The more you can market to your employees, the more we can see participation rates increase. So let's dig into some advice we have around referral programs and sourcing in general. You can see here our advice here. Number one, track sourcing related metrics and adjust accordingly. If you're like most facilities, you're probably using a wide range of channels to drive applicants. But do you actually know which channels provide the most ROI? Start tracking metrics like applicants per source and hires per source to paint a clear picture of which sources drive the most impact. From there, you can develop a plan and adjustments that you can make to optimize the time and resources you have for job board promotion. Number two, modernize your employee referral program. We know that employee referral programs are a great source of quality talent in the healthcare space today, but for the most part, facilities are relying on outdated tools and strategies for managing these programs, limiting the channel's potential overall. And it's time to ditch the spreadsheets and inconsistent promotion tactics and get intentional about your program. So boost participation and therefore quality candidates by sending regular text messaging to your team, reminding them of open roles and bonus payouts in total. And invest in tools that allow you to execute all of this without ever leaving your applicant tracking system. Number three is leverage your existing database. Right? Do you ever feel like you could bring a former employee back or hire a candidate you interviewed for a role a year ago? Well, the reality is that you can. Leveraging relationships you've built over time can actually be a really lucrative strategy for filling open positions. So start by getting your database in order by centralizing all former employees, former applicants, and former candidates, and former referrals. Create lists in that way. Then start nurturing these groups through regular campaign messaging. Of course, getting this right is a massive undertaking, so consider recruitment platforms that facilitate advanced database management and communication automation, such as Hireology. And the last here is sponsor your jobs on Indeed. Because so many healthcare employees are using Indeed, the site can become incredibly competitive. If you're not finding results you're looking for with organic listings only, consider sponsoring your most important jobs. On average, Indeed sponsored jobs result in 55% more applicants than non-sponsored jobs, and are 4.5 times more likely to result in a hire compared to non-sponsored jobs. So next, I want to touch on the overall hiring process. What happens when you get good candidates on board? How fast are healthcare facilities moving? And what's holding them back? We asked healthcare facilities how fast they're responding to initial applicants when they apply. 49% said they typically respond the same day, and half of your competitors are responding to applicants the same day, while another 38% respond within 1 or 2 days. So the headline here is that people are moving fast. Combine this with what we know about applicants, 61% accept the first offer they receive in their job search. And this tells us that you're not able to connect with the applicant within 48 hours of applying. If you're taking longer than 48 hours, you're likely going to lose them to a competitor. The same story is here when it comes to overall speed to hire. So not just engagement, but overall hiring process. 39% say they're able to hire in less than 1 week on average, with another 38% reporting that it takes them 1 to 2 weeks. So again, given that what we know about applicants is that they want to move fast, you need to run a hiring process that takes in total less than 2 weeks, or you're going to risk losing them out to competition or the facility down the street. So what's holding healthcare facilities back from moving faster? When we asked respondents to rank their top bottlenecks, things like collecting onboarding paperwork was the top of the list, followed by checking references, scheduling interviews, and keeping track of candidates in general. All of these are extremely cumbersome and manual tasks. So it's absolutely understandable that these steps are holding healthcare HR teams back. And the good news is there's a lot of tech out there that's purpose-built to help overcome these bottlenecks in the process. So let's dig into that on the next slide. All right. When it comes to slow-moving processes and manual bottlenecks, here's what we typically advise our healthcare customers to do. Number one, track process-related hiring metrics and adjust accordingly. To remain competitive in today's hiring market, you need to move fast on all great candidates. But much like with sourcing, it's difficult to improve time to hire without knowing what's going to slow you down. Start tracking hiring speed and process adherence across locations to identify roadblocks. So think, is interview scheduling slowing you down or running background checks? Make it necessary to change and adjust as you see fit based on what you're seeing. That way you can drive fastest hiring process across all channels. And number two is embrace automation. No matter how many HR employees you have on staff, human beings can only process so much information at a time. These human limitations will prevent you from making faster decisions in your hiring process to a certain point. That's where automations can come into play. We know HR teams are often bogged down by the time it takes to track applicants, schedule interviews, and manage reference checks appropriately. So why not let automation streamline these tasks for you? Many tools out there, including Hireology, offer everything you need to drastically reduce the time spent on these tasks, allowing you to hire faster and focus on more important work. And then last is adopt a modern applicant tracking system. Modernizing and centralizing all of your hiring steps can also make a big difference when it comes to reducing time to hire. So for example, the time it takes to manually switch from your email back to your hiring platform to communicate with candidates, and then your initial team can add, over the course of a year, days to your process. So look for platforms that offer everything you need, from distributing jobs to making an offer in one centralized location. And finally, let's spend some time looking at one of the hottest topics of the past year, and that's AI. AI absolutely has the potential to revolutionize the hiring process for the better. But most employers, and that's not just healthcare facilities, most employers in general, rightfully have concerns about it. But I think it's critical that facilities spend more time understanding AI, because those that do and embrace this forward-thinking mindset will be the ones to win in the years ahead. So when asked about AI, Currently, only about 7% of healthcare facilities are using AI in any capacity in the recruiting process, which makes sense as the idea of AI in recruiting is still fairly new, and it takes time for organizations, especially large ones, to adopt new tools and technologies. But 55% say they feel somewhat or very comfortable with the idea of using it, which tells us that the concept of AI is becoming more mainstream enough that it doesn't scare people quite the way that it used to. You can see here that, however, when they are asked where they see AI playing a role in the hiring process, most said they didn't know, with about 20% identifying top candidates. Overall, I think that these last three slides tell us that healthcare and HR teams are curious about what AI and it can do, and they're open to the concept of using it. They're just, maybe need to learn more before putting it into practice. But like I mentioned, those that do will have an advantage on their competition in years to come. And then finally, it's tough to bring up AI in recruitment without addressing the very valid concern about bias that might exist. So when asked, 47% said they do feel concerned about the biases that might exist when using AI in the recruitment space. Recruiting in HR is a highly personalized yet complex field where the right answers and decisions are almost never clear-cut. It's natural to have some concerns and reservations about adding AI to the mix. When AI has the potential to complete tasks in a human-like manner, it always will lack the intuition and nuanced perspective that a human can bring to the table. Without a human touch, you cannot guarantee that the best decision will be made for the unique needs of your team. So many times, the best candidate isn't always the one with the best resume. So, what's our advice for healthcare facilities who are curious about AI, but maybe aren't sure where to start, or they're held back by sort of bias concerns? Let's dig in. A couple of things that you can do. Number one is experiment with public AI resources. So the data shows that healthcare facilities are cautious yet curious about AI. The good news is that you can experiment with AI without making massive investments by leveraging free resources like ChatGPT. You could use these types of tools to draft candidate emails that you can revise or reuse throughout your hiring process. Or you could experiment with prompting it to write job descriptions. Wherever you choose to try, the key is getting yourself familiar and comfortable with the technology. Number two, invest in forward-thinking HR technology. If you're interested in getting more in-depth with AI, many applicant tracking systems and recruitment software providers are beginning to iterate AI and integrate it into their platforms. Look for solutions that offer tools like automated communication, AI-based interview scheduling, and more. Software providers that are already offering AI in these ways will be the leaders in AI when it comes to competition down the road. Third is get your data in order. AI has the potential to revolutionize hiring for the better. But for AI to be effective, it needs to be trained on complete and accurate data. That means every applicant and candidate in your talent database must have a complete profile. And every rejection, interview, or hire is logged in the system with as much information as possible. So, with a clean database, you'll be able to leverage time-saving tools like candidate recommendation engines, job description writers, and more down the line. The last here is use AI for efficiency, not for decision-making. Concerns around the biases and discrimination are also critical to consider. AI-driven hiring processes depend on the quality of data used to train the algorithms. Biases present in historical data could be worse and made worse by AI, leading to unintentional discriminatory outcomes. So, to ensure fairness and transparency, a level of human involvement is and will always be essential. While you can conduct data audits and improve your algorithm, it will never be advised to leave the final decisions up to hiring around AI only. That human touch is needed. So simply put, AI should be the tool that you use to empower your team to work smarter, not automate the decision making. And so I want to touch on the release of this study that we talked about today. Like I mentioned earlier, if you want to see all this data here, our team is putting all of it into a report for anyone who's interested that they can access. So our scheduled release date for the report is February 5th. So be on the lookout for an email from our marketing team that day, or visit hierology.com/guides on February 5th. So in the meantime, we'll be sending out the recording of today's webinar in case you want to reference the data or any of the reporting that you've seen. And with that, that concludes our webinar today. I want to thank you all for being here and joining. I think at this time, we'll open it up to some question and answer. So if anybody wants to throw a question in the chat, feel free to do so and we can address it here.
Thank you, Brett. I also just added it into our chat for our attendees to see. So let's just give them a few seconds to put those words together. All right. Well, so shall we wrap up? Brett, I'd like to thank you for another great presentation. Thank you so much. And if you have any questions, please send it to info@hierology.com. If nothing else, then thank you so much, and everyone have a lovely day.
Thanks, everyone.